Hello, it's Dr. Fur, Herald Square Psychology, the Therapy Bunny, and today we're going to talk about CBT. CBT stands for Cognitive Behavioral Therapy, and what makes it work? Well, CBT is a form of psychotherapy that enjoys a ton of research. It works well, it's fast. Standard protocol is about 12 weeks, and it's easy to understand, easy to explain, and it has a beginning, a middle, and an end, and then it has kind of like a maintenance where you show up once a month, every 2 months, just to make sure that you have one of the other benefits, which is that you've kind of learned how to do things yourself. It's time limited. It's covered by insurance. Insurance companies absolutely love it. And, it enjoys a lot of statistical analysis. And what it does is it looks at your automatic thoughts, which I'll go into in a moment. And I'll explain how it works, and I'll give examples. So it teaches you how to basically do things yourself. And, again, it's easy to understand and easy to explain how it works. There's no real mysteries here. In psychoanalysis, a lot of people complain that the therapist doesn't really talk much. They're kind of like a blank slate, waiting for you to paint on it, and so that, theoretically, what you bring to the situation is your stuff. That's why therapists go to therapists, so that they can separate their own stuff from the client, because sometimes the client will bring up things in nonverbal ways like feelings, reactions, and that kind of thing. But a CBT person will talk to you, and it's pretty straightforward, and there's no secrets. How did it start? Well, if you went back 100 years ago, Sigmund Freud was coming up with psychoanalysis and implementing it, and it's kind of like a dark opera where, it has Greek mythology sewn into it, where the Oedipus complex, the child and how they feel about their parents and the aggression they have, and then the sexual stages of, the oral stage and all stuff like that. And, the way it worked is that you went 3 times a week. There was no real ending to it. You faced away from the analyst. The analyst would sort of like sit behind you taking notes in a chair, and you'd be sitting on a couch looking at the opposite direction. Rumor has it that Freud started that just because he didn't want his patients looking at him. And it changed a lot. And, it relied heavily on the unconscious. Well, CBT is basically the psychoanalysis with the unconscious chopped off. One of the major founders was Aaron T. Beck. People call him Tim, out of UPenn. And this was like the late 1950s. And what happened is after the psychoanalytic phase of the 30s and 40s, the behaviorists came along and said, you know what? You give me a well-formed child, and I'll show you that rewards and punishments change and shape everything. They can make you a criminal. They can make you like an upstanding person. It all depends on, reinforcement, punishment, positive reinforcement, negative reinforcement, and they didn't really believe in thoughts. And, of course it worked on some things. But along came the cognitive people, and they allowed thoughts. And they started noticing, one of them, Aaron Beck, who I mentioned, he was an analyst, and he noticed when he was doing free association that there was more than just unconscious stuff. He just noticed that people would have automatic thoughts, like They like say you go into a meeting at the company, and all of a sudden you think, oh my goodness, like I'm not prepared, or I should have studied more, or you know, like, oh, I feel safe here. That, you know, just whatever thought automatically pops up in your head. And he started looking at those, and then he connected them to core beliefs about the self. Like these are very deep-seated things that you've learned. Instead of going into childhood and looking at how you related to your parents, just basically how you learned about yourself, the world, and the future. And so those are the 3 core beliefs. And these core beliefs about yourself, like the world is safe or the world is unsafe, that I'm a good person or I'm a bad person, kind of like, or the starting clay to mold with. And as it kind of expands up to consciousness, that there's rules and ways of organizing the world called schema. And schema come from the core beliefs, and that's so like you go into a room and you believe like, I'm a great guy, and you look at the room, you know, for the business meeting, and you have confidence and stuff like that because you believe you're a good guy. So then the rules dictate like, hey, let me take over, let me raise my hand, let me contribute, that kind of thing. Whereas if you had a different core belief about yourself, like I'm an incompetent fool, you're going to go in there, and then the way you organize your mind around that is like, okay, there's a bunch of traps here. I've got to be careful what I say. Instead of just like blurting stuff out, I'm going to stay kind of like, you know, a little bit in the background. And instead of making bold statements, I'll ask questions, you know, to convey the thought that I have and see how it floats, you know, because it's less dangerous. And then the automatic thought might be like, if you're a confident person, like the automatic thought might be like, let me just raise, you know, like, I got this. Like, an automatic thought might be like, I've heard all this before, I got something extra to add to this, right? Or if you think that you're an incompetent fool, your automatic thoughts might be like, if I say something, it's dangerous, right? Okay, so now, Beck started doing research because like schema and all of that is pretty easy to understand, and you can create like little, not little, but you can create questionnaires, and then like, you know, based upon the theory, you can do the Beck Depression Inventory, the BDI. I know you're going to Google it, and it has like 21 questions, and it'll ask you about symptoms of depression, like I'm as confident about myself as aspects of depression. And then at the end, you got a number, and then you can run that number through a statistical analysis and see if it works. And it turns out that CBT for mild to moderate depression is just as effective as drugs. Not that drugs are the silver bullet. A lot of people don't get affected by the drugs. You know, there's a certain amount of you know, some people respond really well to them, and some people don't. And same thing with therapy. But in the trials on depression, it turns out that CBT will work just as well as pills, and then you don't have to worry about like the tolerance of the drugs or the unintended consequences of putting these chemicals in your body and affecting your minds, and you don't have this long-term dependence on the drugs. In the terms of depression, you know, I mentioned the core beliefs. Well, in depression, there are 3 core beliefs. I really hope I put a graphic on this. So like imagine like a little circle, and we'll call one the self, and another circle called the world, and down here is the future. And so like you got 3 circles, the self, the world, and the future. And these are core beliefs that you have about it, and they relate to depression. And in the case of a depressed person, the self is incompetent, can't get anything done, things just don't go my way, the world is a hostile place, it's uncooperative, that boss is getting in the way, I'll never, I can't get it, the world's not working with me. See, oh my goodness, look, that happened again, because that's just the way the world is. And then the future is hopeless. So just to recap, in the cognitive triad for depression, the self is incompetent, the world is a hostile place, and the future is hopeless. And if you can tweak one of those, then the rest of them will follow. And so what you do is you sit down with a client and you start eliciting automatic beliefs, and you sort of trace them back to the rules that led up to this automatic thought, and trace that back to the core beliefs, and it's all based upon thoughts, right? And they have like a little thought record, because one of the things about CBT is they give homework. And so they'll be like, okay, so like I guess we're using a business meeting. Next time in there, go ahead and raise your hand and contribute, when you think you have a really solid thing to contribute, So then they'll have like this little chart like that you fill out before your next session. Like, what was the situation? A business meeting. What were my automatic thoughts? This is a dangerous meeting, or I've got this, right? But if we're talking about depression, it might be like, I don't know what to do. I'm not sure of myself. Everybody's going to laugh at me. And it's never going to change. This is the way it's always been. This is the way it'll always be, right? And then the therapist will sit through and start asking you questions about that, questioning your thoughts, looking for distortions in the way you're thinking. Like, is there any evidence that you don't have anything to contribute? So here's an example. Well, I did do a report on the data that we were presenting that day. Oh, so then, would you say that it's accurate to say you have nothing to contribute? And then the client might be like, well, you know what? I guess I have something, but they're just going to tear it apart. Okay, so let's move on to the world core belief. Is there any evidence that they're going to tear you apart? Well, I made a mistake once. Do people remember that mistake? I don't think so. I'm having trouble remembering it myself. Has anybody called you out and embarrassed you in the meeting before? Well, that's never happened. Well, do you think you can change those things and change the future? I guess I could try. All right, so then you got the homework, like go contribute to the meeting. So that's in a nutshell the way CBT works from Aaron Beck's point of view. So there's the thoughts, you teach them how to do it, and then every few sessions you have them fill out the depression inventory. But this works for a lot of things. They say it works for personality disorders, they say it works for anxiety, it works for all these different things, works for interpersonal relationships, that kind of thing. And so in essence, that's an Aaron Beckian, considered the founder. So you started out with the first wave of behaviorism, where they were just like, everything is stimulus response, there is no thought. And now we have the cognitive revolution, where thoughts really matter and it's effective and it's easy to implement. And then there's the current new wave, which is the mindfulness bit, because people started noticing anomalies in the outcomes. Because remember, we're tracking data here. That's why insurance companies love CBT. That's why people love it, because there's no real mysteries. You can see, you can graph it too. You can see the results, and you can see the depression go down. There's another founder called Albert Ellis. I did another video on him about change your mind in 3 easy steps. So basically he says, like, an activating event comes along. A, right? And an activating event. You walk into a business meeting and everybody looks up at you. And that leads to an emotional consequence, C. So A goes to C. Activating event, I walk in, everybody looks at me, and I have an emotion, which is worry or panic or something like that. And he would say, it's not the fact that everybody looked up at you in a business meeting, it's your beliefs that made that worry. If you held a different belief, a more flexible belief, a tested belief, like instead of like they're going to tear me apart. If you had a different belief, like I got this, then the emotional consequence, C, would be different. So like, let's say the activating event is you walk into a business meeting, everybody looks up at you, and then your belief is they're going to tear me apart, then that would be worry, consequence C, A, B, C. See how that works? It's easy to explain. But if you held a different B, a different set of beliefs, like I studied for this, I've done this before, I can do this, right? So an activating event comes along, you walk into a business meeting, everybody looks up, and your beliefs are, I've got this, I can do this, I'm prepared for it. It leads to an emotional consequence C, which is nervous but confident. Right. And then, the therapist would start digging into those beliefs. Like, you said you were nervous. Like, what is it about this meeting that you believe that would be grounds to be nervous? And it's like, well, I could make a mistake. And then, Albert Ellis had all of these wonderful things. It's like, well, can anybody not make mistakes? Well, can't be human without making mistakes. Do people sit there and go home and be like, oh, let me tell you about all the mistakes that everybody made today? Because anxiety is really just about the self. Most of the time, people really don't think about it. Maybe if you do something egregious, but even then, just look at the career paths of celebrities and politicians. They screw up all the time, and we don't really think about it. It's kind of like the what have you done for me lately kind of thing, like what's going on with you now. We don't think about it so much. And so these are the two major foundations for cognitive therapy. So to recap, it does work. It lends itself well to research. It's easy to explain. It's easy to administer. It's time limited. You set clear goals. You explain the model, and then you figure out where all of these activating events are, and then you within reason you go about and you test them. Now, Albert Ellis would say, people would have beliefs like, oh, I'm a shy person. He would make them go down to the subway and announce all the stops on the train. Coming up to Christopher Street, or coming up to, Broadway, or West 34th Street, transfers available for the D train, the B train, the F train, and the AC and, E train, that kind of thing. And then people all of a sudden would start to realize that this is not the dangerous thing that they are, because they're testing their beliefs, right? And then their emotional consequence changes and they become less shy. Boom, boom, boom. And so it's really handy. Now, if you compare that to psychodynamic, like things that evolved, just as CBT evolved from behavioral points of view and into mindfulness, so did psychoanalysis turn into short-term kind of therapies, and they perform generally as well, but they don't lend themselves to research as much. At any rate, go back to my short video. This is Bunny Therapy, and look at the ways to change your world and your beliefs. And I'm going to do a couple shorts that'll sum up the benefits, but also there's another side to CBT that you should know, and that's the stuff the things that they don't talk about, which is why it may not work. Okay. Having said all that, that's CBT in a nutshell. And yeah, it works for what it's good. And it is good, but it's not